We protect, we care, we are your near and dear.
Good morning, Doctor.
Good morning. How are the kids?
They are doing good. We are here to take some advice about health and nutrition.
Well, the period of greatest risk for a child is the first month of their life. During this time, the baby is highly at risk of infections.
Is it? Then how can we keep our baby out of risk?
Not only baby, both the mother and baby require clean surroundings, nutritious food, and regular health checkups.
What could be the nutritious food for a baby?
For a baby, nutritious food is solely provided by breast milk. Beginning in the first hour after birth, there are some warning signs that indicate your baby is ill.
Signs? How can we identify them? And what should we do if our baby becomes ill?
If you see your baby cannot drink breast milk, lack of movement, being unconscious or less movement, listless, infection in the navel, blisters or fast breathing, fever, convulsion, you should immediately bring your baby to the nearest healthcare service point.
Children under 5 years continue to be at risk of many diseases and conditions. Coughing and sneezing around children can spread pneumonia.
You should not pollute the air by coughing or sneezing around the baby. It may weaken her immune system and cause pneumonia.
Yes, you're right. I'll be careful from next time.
If children have pneumonia, they may not eat or drink, may become unconscious and suffer from hypothermia or convulsion. Contaminated water or food by unhygienic environment, taking food without washing hands can cause diarrhea.
What should we do if our kids have diarrhea?
The affected child should be given oral saline frequently, more fluids than usual, nutritious food, including breast milk. In case of any complicacy, you should promptly consult with a health worker.
So, we can prevent diarrhea by avoiding the causes of the infection.
Yes, you got it right, Mr. Robin. You should let your children sleep under insecticide-treated mosquito nets, spray of mosquito repellent indoor, and eradicate mosquito breeding sites to prevent both dengue and malaria. Some variants of mosquito can cause malaria or dengue.
What are the symptoms of malaria, doctor?
A malaria-affected child may have symptoms of fever, headache, or loss of appetite. It can be treated with various anti-malarial medicines. On the other hand, dengue can be life-threatening that leaves more serious symptoms like fever with severe headache, muscle and joint pain, nausea, swollen glands, skin rash, and vomiting.
Measles is another life-threatening contagious viral disease that can be prevented by immunization. HIV is a disease that can transmit through blood or breast milk from mother. The risk of transmission from an affected mother to child can be greatly reduced by taking antiretroviral drugs throughout the pregnancy, delivery, and breastfeeding.
Look, our Emily's growing up healthy. Now you should be prepared to take care of her mental health because some risk factors can cause mental harm.
Yes, Mother, we shall take care of it.
Preeti, let's go to the doctor's chamber.
All right. Good morning, Doctor.
Good morning. How are the kids?
She's all right.
It is really good that Emily has already completed the full course of immunization because immunization is a safe and effective way of preventing and controlling many diseases.
Oh, really? Which diseases?
Yes, look at this vaccination chart. After birth, the BCG vaccine is given to prevent tuberculosis. During 6, 10, and 14 weeks, pentavalent vaccine is given for preventing diphtheria, whooping cough, tetanus, hepatitis B, Haemophilus influenza type B. Pneumococcal pneumonia, poliomyelitis. At 9 and 15 months, the MR vaccine is given to prevent measles and rubella. Parents should guide and teach children good habits like hand washing, brushing teeth, using hygienic toilet, developing good eating habits, etc. For all these activities, it is important to wash your hands the following way. First, you will have to wet your hands, then apply soap on hands for 20 seconds, then scrub back of hands, wrists, fingers and under fingernails. Then you will have to rinse your hand, turn on the tap and wash.
Thank you, Emily, for brushing your teeth and washing your hands so nicely. It is so important for good health and hygiene, and we shall live a healthy life.